Okay, you want to be able to palpate your ribs and your intercostal spaces. All right, so here we go. So now keep in mind, this is what we would be doing to each other if we were in lab together. So the first thing we would do is we would find the clavicle. Okay, so you now do this to yourself. So palpate. Okay, so you can take your left or right hand and palpate your right clavicle. Okay, right there where it meets the manubrium. Okay, it should feel like a bony structure. All right. And then you want to kind of get like right here on the clavicle because we're going to go straight down. So you don't want to be on the actual breastbone, which is the sternum and the manubrium. You want to be just off to the side, a little bit lateral to the manubrium and the sternum. Okay, so you should feel the clavicle. And then as you palpate inferior, you'll feel rib 1. Okay, it's a bony structure. You'll feel rib 1. And then if you keep going inferior, you feel a soft spot, a distinct soft spot that kind of feels like a bruised apple. Okay, that's the intercostal space. Okay, that's an important word that I want you to know. The intercostal space. Okay. And what that means is in between the ribs. The intercostal space is in between the ribs. Okay. All right. So if you keep palpating inferior, you'll feel another bony structure. Okay, that's rib. And if you keep going inferior, you will feel a second soft spot. You'll feel a second soft spot. Now on your screen, what I'm circling there is the A. That second soft spot is the aortic valve. Okay, that's what the A stands for, the aortic valve. Okay, so here's what, so if you look at your screen, I'm going to write something, and it's A, P, E, T, M. Okay, I off-center them on purpose. You have the A, the P, E, T, and then the M. It's supposed to be an arrow. It's a terrible arrow. T, there we go, M. Off-centered on purpose. Okay, here's the quick version. It's a pet monkey. That's the mnemonic for that. A pet monkey. APETM. Now, if you look back on the thoracic cage, I'm going to circle everything. All right, let me change the color here. Stands out. So there's A, P, E, T, M. A pet monkey. Okay. The A stands for the aortic valve. The A stands for the aortic valve. Hold on, I'm trying to get my stylus to not write so thick. There we go. So A equals aortic valve. Okay. The P, hold on. I want to go to a blank page so I can do some more writing. So give me a sec. Okay, I'm going to screen share something different with you. There we go. All right. So it's A, P, E, T, M. Okay. All right. What this stands for, the A is the okay, now watch this. Second intercostal space on the right. Very important to know that. The aortic valve is best heard. The aortic valve is best heard on the second intercostal space on the right. Okay, now when you're learning, especially in a student clinical setting, to show your instructor you know what you're doing, you palpate, and you can even think out loud. You can say, so I'm palpating, there's the clavicle, there's the first rib, first intercostal space, second rib, second intercostal space, okay? And there it is. Place the stethoscope, not over the sternum, but over the space. And on that picture that you all have of the rib cage, okay, the A is showing you the space to put the stethoscope. All right. Then what you do is you move over to the left side. Now keep in mind, here's the sternum. Okay, there's the sternum. So now you're going to go to the other side, to the left side, and you're going to go after that P, which is the pulmonary valve, second intercostal space on the left. Okay. Now keep in mind, this is not necessarily the actual location of the valve. This is where you hear the valve the best. Okay, so don't confuse actual anatomy location versus this is just where we hear it the best. That's what this stuff means. All right. So you hear the pulmonary valve the best over second intercostal space on the left. Okay, then you go straight down, go inferior, and you're going to reach what's called Erb's point. Okay, so if you go back to your that nursing guide I sent everyone, okay, you'll see Erb's point is where the S1 and S2 heart sound are equal in pitch. Okay, so that's Erb's point. And that is best heard at the third intercostal space on the left. Okay, then you go inferior to the T, which is tricuspid valve, and that is heard best on the fourth intercostal space on the left. Okay, so the tricuspid valve is heard over the fourth intercostal space on the left. Now, this next one's a little tricky, okay? And this is the mitral valve. And this is heard best. Here's the tricky part. This is heard best over the fifth intercostal space on the left, mid clavicular line. Okay. Mid clavicular line. So what you have to do is visualize, all right, palpate and visualize. You on your picture of the thoracic cage there, you can see the clavicle. Okay, and the clavicle is a certain length, and all you do is you bisect it or dissect it, right in the middle, that's mid-clavicular line. So an imaginary line in the middle of the clavicle, straight down the rib cage, that would be mid-clavicular line. That's where you hear the mitral valve the best. In men, easy to get to for the most part. And then in some women, you might have to move breast tissue out of the way and maybe even clothing like bra and whatever to try to get that stethoscope on skin to hear the mitral valve. Okay. So it just depends on the clinical circumstances. If a person's laying down, if they're sitting down, do they have an exam gown on? Do they have all these clothes on? Whatever. Okay. And also clinically, it's not hard to figure out if you have to get some breast tissue out of the way to get access to that location. All right. So that is, all right. So those areas, those 5 areas, a pet monkey, okay, that is where you strategically place the stethoscope to listen to the heart valves. Okay, so you're not just randomly placing it everywhere. There's a strategy to it. All right, let me get back to the rib cage. Okay, so you can see here, there's your APETM mid-clavicular line in the space because the vibrations, the sound that the valves make is heard better through a space than over bone. Okay. Now, next week, we'll go down and look at some blood pressure stuff. So I've got some cool information there. So that will be once we cover tubes and what happens when you kink a tube with the blood pressure cuff and so on. And then this other one on your reading right there is how you auscultate a lung. And we won't really get to that till we get to the respiratory system. Okay. All right. So, so a couple of, actually, any questions before I go on to the next thing? All right, so we're good? Cool.